Hello and welcome to my channel MT Hacks, and you're watching Transcription with Mansoor. In this video, we are going to talk about the Glasgow Coma Scale from a medical transcriptionist point of view. The Glasgow Coma Scale, GCS as it is abbreviated and usually dictated by physicians, provides a practical method for assessment of impairment of conscious level in response to defined stimuli. Based on motor responsiveness, verbal performance and eye opening to appropriate stimuli, the Glasgow Coma Scale was designed to be used to assess the depth and duration of coma and impaired consciousness. This scale helps to gauge the impact of a wide variety of conditions such as acute brain damage due to traumatic and/or vascular injuries or infections, metabolic disorders, etc. By metabolic disorders, we mean hepatic or renal failure, hypoglycemia, diabetic ketosis, and the likes. Now, let's take a brief look at the responses. The first one is eye-opening response. If the patient spontaneously opens the eyes with blinking at baseline, then 4 points is the score given. If the patient responds to verbal stimuli, command, speech, etc., score given is 3. If the patient responds to pain only, the pain being not applied to the face, 2 points is the score given. And if there is no response or the response is nil, then 1 point. The next thing the physician has to look for is the verbal response. If the patient is oriented, then 5 points is a score given. If confused conversation but able to answer questions, then 4 points. If words are inappropriate, then 3 points. If the speech is incomprehensible, then 2 points. And if there is no response, 1 point is the score given. Then comes motor response. If the patient obeys commands for movement, then 6 points is given. Purposeful movement to painful stimulus elicits 5 points. If the patient withdraws in response to pain, then 4 points. If flexion is the response to pain, then 3 points. If extension is the response to pain, then 2 points. And finally, if there is no response, 1 point. Based on the eye-opening, verbal and motor responses, head injuries are classified as 3. If the GCS score is 9 or less, then the categorization is severe head injury, or what you call coma, where there is no eye opening, no ability to follow commands, no word verbalization. That is called a coma. If the GCS score is somewhere between 9 to 12, then the classification is moderate head injury. If the GCS score is 13 to 15, then it is classified as mild head injury. Now, as a transcriptionist, where can you expect to hear GCS when you're transcribing? You can expect to hear the dictator dictating GCS in the history of present illness and the physical examination. Normally, it could occur in other places, but normally it's just the HPI and PE. These are things a medical transcriptionist must know about GCS. With this, we conclude today's lesson. This is Mansoor signing off for MT Hacks. If you want to know more about today's topic or anything related to improving quality and increasing productivity in medical transcription, please leave a comment below and I will try to help you.